Welcome, and thank you for joining us for our webinar, Bringing Bioethics to Policymakers, Learning from Experience. I'm Michelle Groman, President and CEO of the Greenwall Foundation, and your moderator for today. The Greenwall Foundation seeks to make bioethics integral to decisions in healthcare, policy, and research. One of our strategic priorities is increasing bioethics' impact on policymaking. It is critical for bioethics to be at the table when public policy decisions are being made. This afternoon, we'll be exploring how to get bioethics to that table by talking with three folks who have worked to do just that. Among other things, we'll hear about their strategies for connecting with policymakers, the challenges they encountered, and lessons they learned for future work. The Greenwall Foundation funded each of today's panelists through our Bridging Bioethics Research and Policymaking Grant Initiative. Through that initiative, we do not fund bioethics research, but rather support those who are taking the next steps to bridge the divide between research results and policy. An RFP is open for that initiative right now, with applications due on July 22nd. You can find that RFP and more information on our website, greenwall.org. One of the great things about the Bridging Bioethics Research and Policymaking initiative is how open-ended it is in terms of how to make the connection between bioethics and policy. It's been a wonderful opportunity for us to learn from the field, and I hope for those in the field to learn from one another about what works and what doesn't. Each of the three projects we'll be discussing today was very different in topic, different in audience, and different in approach. So I hope there will be something for everyone. It's a great trio from which to draw cross-cutting themes and dig into what makes each unique. We'll begin with a short presentation from each of our panelists about their projects. We'll then turn to a moderated discussion and questions from the audience. You can submit questions at any time using the Q&A function. The webinar is being recorded, and we will upload the video to YouTube and the Foundation's website in the next few days. So now for the good stuff. Our first speaker is Bob Cook-Deegan of Arizona State University, who led the project Policies to Improve Assessment of Inherited Cancer Risk. Bob, over to you.
Thank you. Thank you, Michelle, and welcome to everyone who's participating. I'm just going to plunge right into it. So if you could show the first slide. So before we get started, I teach technology assessment in one of my courses, and this is a modification of the Heil-Myers Catechism that was developed for the Defense Advanced Research Project Agency as a way of formulating what they should fund. They were, of course, focusing on technology, and I've adapted it for those who do policy-oriented research. These slides will be available, so if you find this useful, for your teaching or for whatever, this will be available for you. This is just kind of a framing set of questions that we've been using to think through when we're trying to take information that we've been doing in our research and make it useful to folks who need to make policy decisions on a schedule, in a form, and with clarity about the messages that allow them to actually make some progress forward and make the decisions they need to while taking the evidence that we've developed into account. So the next slide. Having talked about the general framework, let me plunge into the very specific question that we were dealing with. We focused on trying to develop the collective knowledge commons that's needed to be able to interpret inherited cancer risk. That is, looking at genes that are associated with cancer risk and testing that's going on all over the world, mainly in clinical labs, not so much in research anymore. And the need to pool all that information and link it to what happens to people, the health outcomes, who develops cancer, who doesn't in a family. And all that information needs to be consolidated into a commons in order to be maximally useful. And the theoretical foundation for that is commons theory that was developed by Eleanor Ostrom and her colleagues. At the beginning, she focused on commons that were things like fisheries and depletable resources, but towards the end of her career, she started focusing on knowledge commons and including things like data sharing. So next slide. The situation that we thought was relevant for thinking about a commons is exemplified here. And this is the situation in 2015. And the diagram on the left is kind of complicated, but here are the 5 major databases that existed for just 2 genes, BRCA1 and 2, the genes that are associated with inherited cancer risk for breast and ovarian cancer, and among the most thoroughly studied genes in the whole human genome. And this diagram shows where you could find information about the variants that are associated with in those 2 genes. And just to let you know, the vast majority of those have either not been reviewed or can't be classified. And the reason is because most of the variants are really, really rare. And those are out in those outer lobes of these 5 databases. So ClinVar is the database that's maintained by the National Center for Biotechnology Information at the National Library of Medicine. And it had almost 4,400 variants that were not available in any other database. So somebody encountering one of these rare variants would have to go to all 5 of these databases to see if they could find whether anybody had ever come across it before and how they had interpreted it. So the groups on the right there, the Global Alliance for Genomics and Health, BRCA Exchange, Human Variome, LOVID, SIMBA, Enigma, and ClinGen, these are all groups that had come together to begin to work on this problem. Next slide. And it's particularly acute because the variants in these genes are quite different in explaining cancer risk in different populations. So the variant that's most common and accounting for over 85% of the inherited risk in Iceland or in the Northern Islands of Scotland is completely different from the 3 variants that were discovered in Ashkenazi Jewish populations. And we keep coming up with, when you look at any population that has been isolated for any period of time, you will discover new variants in BRCA1 and 2 that are not really shared very commonly with other populations. So we've got a lot of variants and needing to link it to a lot of health information. And that was why we thought it was important to develop a theory for a set of practical recommendations for dealing with how we could make sense of these variants. Next slide. So we did something called the Sulston Project that was named after John Sulston, who was one of the leaders of the Human Genome Project. And one of the projects he was involved with was the sequencing of BRCA2, and he felt passionately about data sharing and building the knowledge commons. Next slide. But the Sulston Project built on 3 previous projects, and I just wanted to give some credit to Dave Kaufman and Amy McGuire. Amy's at Baylor College of Medicine, and Dave Kaufman was at Johns Hopkins and then moved to the National Human Genome Research Institute. And back well over a decade ago, we decided to do a study on how genetic information, particularly genomic sequencing, was going to be incorporated into clinical decision making. Cancer is one of the places where that wave is breaking. And so we did a project that was based on a Delphi process about figuring out what do we need to do to make this process smoother and more effective. That led to building the medical information commons that Amy and I were the leaders of. And that in turn led to this very specific project on inherited risk of cancer. And as that project was coming to an end last year, miraculously, the Greenwall Foundation did these bridging grants, and we were well positioned to be able to take the messages that we had developed over 4 years of research to the places where somebody could actually do something about it. Next slide. So now I'm going to go to word slides and focus here on the green parts. So as part of the Sulston Project, we looked at case studies of selected populations, African-American women, indigenous populations, and Latino populations. All of these, we were looking at them because they are underrepresented in clinical databases. And we wanted to see what can we do about that. And we also did a modified policy Delphi to think about general questions. Two of the themes that emerged from that are in green, and those are the ones that are relevant for what we're talking about today. One was to build the commons, you need to share data. Most of the data are generated by private labs. And the problem is that it costs money and is troublesome to get data into public databases where everybody can see it and use it. So there's a constriction point between laboratories generating the data and the public databases that are used to interpret those data. And so we came up with a set of policy options, which is basically you either get paid more if you do that, that is, if you share your data, or as a condition of getting paid, you don't get paid if you don't share data. So those are policy options that emerge from our research. Sounds simple-minded, but it's complicated. And then a second policy stream emerged out of the controversies over gene patents. And of course, BRCA 1 and 2 were the subject of the case that went all the way to the Supreme Court, the Myriad case in 2013, that basically invalidated patents on DNA whose sequence is found in nature. And the previous year, there had been a case from Mayo that invalidated method patents on ways of associating what's going a particular diagnostic biomarker with a clinical outcome. So the reason that that's a policy issue is that in the wake of those two decisions, there's been a proposal to restore patent eligibility to before those cases, to what they were before those two cases were decided by the Supreme Court, basically to overturn what the Supreme Court has done, which is possible because Congress is, under the Constitution, responsible for patent law. So the Supreme Court has created these exceptions to what can and cannot be patented, but that could be reversed by Congress. Next slide. So along comes, so we've done the research, keeping track of those two policy streams, and we were publishing the results of our research when the Greenwall Foundation announced this program. And what we decided to do was engage Burness Communications. This is a group that does work only with nonprofit organizations. I'd worked with them through the Robert Wood Johnson Foundation, the National Academies, and Duke. And it made sense to bring them in to augment what we were already doing. They helped us refine our website, turn it from a work site to something that was more public facing. And they helped us think through what the messages were and helped us organize what we were going to do on the Hill, meeting with Congress, and also with folks in the executive branch at NIH and at the Centers for Medicare and Medicaid Services. Those are the two units that can do something about these problems. So next slide. So of our grant, half of the money went to Burness Communications, and most of the rest of it went to the research assistant who did most of the work, Susanna Skvarkova, and then Pat Dverka, who has been working in this space for decades and helped us write one of the two papers that became the focus of our policy initiatives. They helped us by doing training for our whole team, giving us feedback on the website and refining our briefing materials, and then making us go through painful rehearsals that refined our messages, because we get lost as academics in the arcana of our fields. In particular, the two papers that emerged, and the links work, I just checked them this morning. The two papers that are the focus for this policy initiative are available open source through the Journal of Law and the Biosciences. But those papers are long. One of them is 37 pages, one of them is 20 pages. Most folks on the Hill are never going to read those. So what we've done is translate those into 2 to 3 page documents that we can use as briefing materials for meetings. And then we've held one round of those meetings and we're setting up another one. The paper on patent eligibility just came out last week. So we are now going to be scheduling meetings with the committees of jurisdiction, the House and Senate Judiciary Committees over the coming month. Next slide. So the last thing I wanted to do, this is my last slide. The reason that we did this was to engage Burness communication is because there really is a specialized skill in figuring out how to communicate to an audience that is not immersed in the technical communities of which we're a part. So they brought fresh eyes. They forced us to translate our thoughts into plain English, iterate through training and then rehearsal sessions, and then helping us refine the materials that we're going to use during the briefings. The benefits for us were taking the work that we had done and turning it into form that was much more likely to be useful to the audience we're trying to reach in Congress and in the executive branch. So for these particular two areas of policy, the federal government's the only agent that can do anything about it. So the executive branch, they could do that by executive order or regulation. And in the case of patent eligibility, that's going to require action in Congress. And the data sharing initiatives could also be imposed through mandates under Medicare, Medicaid, and other programs that are subject to federal jurisdiction. But one benefit of this is our trainees, that is the research assistants, postdocs, and junior faculty who've been involved with this, also got training in how to take their work and make it useful for policymakers. So we're now positioned to do this on our own without using Burness Communications. And I look forward to any questions, and we can continue the discussion after the other speakers. Thank you.
Wonderful. Thank you so much, Bob. We'll transition now from a project targeting federal lawmakers to one located squarely at the State House with Kirstin Matthews of Rice University. Her project was disseminating vaccine information and increasing equity during the 2023 Texas State Legislative Session. Kirstin, the floor is yours.
Thank you so much. Can we switch to the first slide? So I wanted to tell you about my project a little bit. Unlike Bob's, where he was developing recommendations and disseminating, we started with a set of recommendations that we've been working with over the past couple decades in order to increase vaccine equity, access, equitable distribution, and to promote public health measures. We focus on the state of Texas because I'm sure most of you are aware Texas is a quite conservative state, and a lot of stuff that happens within the state we see mimicked in other ones in the region. It's also controlled. The governor's office is controlled. The lieutenant governor and both the Senate and the House is controlled by Republicans. We also have a kind of an odd system where we only meet every other year on odd years, and it's a manic 120 days where actually most of the work happens in March and April, and all the laws are passed in May and then closed down unless the governor picks a special session, which is only on specific topics. Next slide. For this project, we decided to work with a Texas-based advocacy group called the Immunization Partnership, and this helped a lot because it helped us guide our messaging, identify key issues to talk about, and navigate the state session. What we decided to do, we also worked with our communications team like Bob did. We started with actually creating a public-facing website similarly, and ours is called Vaccine Cause Adults. We wanted it to be kind of pithy. We wanted it to be easy to explain. We had published 4 Texas-focused policy reports, and the one on the left is one of those examples. That one is discussing legal arguments and consequences of claiming vaccines as a protected class. We took those and developed 6 one-page brief descriptions of the work and a few others. The example is here on the middle one that focused on vaccine equity issues. In addition, we decided to also create one-page frequently asked questions. These are issues we wanted to talk about, but also issues we heard circulating within the members. And here's an example of one that is how vaccines create immunity. It is quite simple. I actually did go through and we walked legislators about what vaccines actually are. And it was required because there was a lot of misinformation about what they do and the consequences of them. And then finally, we also created a social media plan that focused predominantly on Twitter, a few things on Instagram and LinkedIn. We did not use TikTok because the state banned TikToks for state legislators. But our legislators were very active on Twitter, so that's the focus that we did. The next slide. The goal wasn't just to engage policymakers, but also to include some of our student and staff to get involved in the policymaking process. And a small group of rights students actually volunteered to lead this effort. They helped create these infographics that I showed. They've also created a bunch of memes for us, and here's 2 examples. Some of them were fun, like the one on the top, dinosaurs didn't get vaccinated, look what happened to them. And most of them, though, were informative. The bottom one quotes data from the World Health Organization, as well as linking to papers that were coming out and being published, as well as ones that we had printed within the project. They were all posted on the organization's accounts, which was vital because a lot of anti-vacciners tend to stalk individuals, so we wanted to make sure students who are involved didn't get harassed. We used the papers and memes to create large print posters that we displayed throughout the Capitol. And here's one example that was based off of the vaccine equity frequently asked questions that used another meme in the corner that we had used in social media. Then next slide, please. A lot of what our work was focused in on 3 specific events. We went to the state capitol in Austin twice with large groups, and then we did a social media awareness campaign predominantly focused in Houston. The students actually recruited other students from across Texas because we knew not just Rice students would be heard within the session. So students from UT Austin, Texas A&M, Baylor College of Medicine, and UT Health all participated. Overall, in all 3 events, we had over 100 students who were engaged with it. We were recognized by the House of Representatives. Representative Ann Johnson actually did a bill for us. And to tell you how controversial vaccines were during the session, we, instead of getting an up and down vote like all these resolutions do, because it actually is non-binding and it just means, you know, congratulations for showing up, ours actually had a vote. So everyone had to vote yes or no for it. Fortunately, it passed. I guess now I know who opposes vaccines because they were the ones opposing us visiting the Capitol. The students, as you can see, we wore a lot of matching shirts so we could be identifiable. They visited offices, stalked legislators in the hallways, and then we also hosted a coffee meet and greet where we offered free coffee to staff and members. And then when they showed up, we talked with them about vaccines and showed them our posters, and especially had the students engage with them. In addition, I mentioned the Social Media Awareness Day, and here's a picture of one of the graphics of the postings. We had a bunch of signs that students, faculty, staff could actually post at different areas in Houston. And they could post it on their own social media. We posted it on ours. We also helped them identify their local representatives and encouraged them to email their offices. We gave them pieces of papers that we filled out that they could go and write emails, or a website that they can link to where they could just put a generic email out to their legislators supporting vaccine policy. Next slide. No, this is definitely one of those, it takes a village. So obviously it was vital for the funding for the foundation to help kind of implement this, to put everyone together, to really help us with the strategic planning. The immunization partnership it was really vital as well. They helped organize the event, helped keep track of what was going on with the legislature. It felt more important to respond to what was happening versus pushing a specific agenda. And that was really part of what the immunization partnership did with us. In addition, I mentioned 4 specifically student organizers. All of them are actually graduated now and off to, I think they're all either grad school or medical school, but they were really vital in creating materials, recruiting others. And I think in the future, they'll also be pretty involved in policy from the experience, as well as the students who actually attended. Obviously, we had a great staff. Overall, I think we learned that actually having the students participate, not just leading it, or not just showing up, but also leading it, was really important and valuable. I think it gave them great skills. They owned a lot more of the project than I anticipated that personally, and it felt like when they visited the Capitol themselves, they were running around visiting as many different offices that weren't even on the list of ones we asked them to do. In addition, recruiting other students by students themselves was way more effective than I think what we could have done, staff and faculty. In addition, we also learned that it really required pivoting, unlike other state legislatures I'm not sure of, but Texas, a lot of the bills that pass actually are ones that are actually filed and released in the middle of the session. So you need to keep up with what's going on and to ensure that you can either get access and a bill through, or to ensure that bad public health measures don't have. And I threw my contact information if others have follow-up questions. Thank you.
Wonderful. Thank you so much, Kirstin. Our final presenter with work focused at the local policy level is Nancy Berlinger of the Hastings Center, who led a project, Housing America's Aging Society, a bioethics standpoint for policy development. Take it away, Nancy.
Thank you, Michelle and colleagues. So this is an effort somewhat like Kirstin's and also somewhat like Bob's to figure out how people can have conversations about a complex topic. So what we wound up doing was co-creating a discussion tool for local collaboration to meet the housing needs of moderate income older Americans. More about that in a moment. But if you want the big picture, it's supporting aging through housing choice. Next slide, please. So this is a concept map of work that was begun at the Hastings Center, my institution, starting in 2016, after many decades of work at the Hastings Center, some of which led by me, about medical decision-making being the primary sphere for looking at aging. You realize when you work on that for long enough that that is certainly not the sum total of what it's like to be a person in late life. So we convened a planning process in 2016, lasted for 2 years, called What Makes a Good Life in Late Life. From this emerged a research blueprint for ongoing work around housing equity for older adults and also for dementia care. So I'm going to be talking about the housing cohort in particular. This involved an enormous broadening of our research networks to include social gerontologists, housing planners, architects, many, many others. A key collaborator here is the Joint Center for Housing Studies at Harvard and my colleague Jennifer Malinsky, who is the authoritative researcher on qualitative and quantitative research concerning housing equity in late life. She's the author of a major report that's heavily cited by policymakers. Next slide. So what we did as our first collaboration beyond the initial phase was during the pandemic. Jen and I got interested in pandemic pivots that were supporting and protecting older adults at home. Of course, we know during COVID, older adults were the single most vulnerable population. We were interested in learning from experiences throughout the United States. We did gray literature searches to find out how people were connecting with each other, building networks to create ways of supporting people, which then could perhaps be carried forward. We call these promising practices and policy ideas. Through this, we developed a normative lens, the housing lens that we call it, which focuses on the role of home and neighborhood in older adults' health and well-being, because it's a place where people who are older spend a lot of their time. It highlights their difficulties in paying for housing and care in late life, so no pie-in-the-sky solutions that are premised on a person being wealthy. And it clarifies how policy analysis and development concerning older adults can start from housing and productive challenges of everyday life, rather than always starting from the clinic or the ICU. When we heard from policymakers who are part of our Housing, Aging, and Health Research Network, which we also launched at the same time, they said this would be very helpful to them because they were under a lot of pressure to always make everything about aging fit into housing and health and healthcare expenditures, and preferably cutting healthcare expenditures. They knew there was more to the picture of late life than healthcare expenditures, but they weren't always sure how to talk about this. Next slide. So why does housing matter? Here's the sort of quick normative slide. Notice there's no use of words like normative or ethics. It's a deeply valued part of human life. Home equity is also a key source of wealth for homeowners. It's a public good that benefits residents and communities, and it has special importance in late life for the reasons that I mentioned. Next slide. So what we learned through all of these years of collaboration is that the U.S. housing stock does not reflect our aging demographics and the needs of older adults. Those are the needs are cost, accessibility, and fit. Is a good place to age. This is a subset of the national shortage of affordable housing that you hear so much about, but it has special features. For one thing, older adults are extremely price sensitive because they already have difficulty paying for their housing and their care, and only 4% of the US housing stock is built to be accessible. The barriers to fixing the problem for older adults may differ locally. Sometimes there's not financing available. Housing development always involves the private sector, absolutely, and developers are looking to make money or at least not lose money. Restrictive zoning, conflicting regulations, red tape certainly emerged in our pandemic research because a lot of this was set aside. And when you saw it come back, you realized the freedom you had during a pandemic was not going to continue under everyday conditions. And community resistance, often known as NIMBY, which can arise in all sorts of different ways. And sometimes people who you think are going to be on your side turn out not to be on your side. However, during the same period, there arose encouraging signs from the national housing-focused YIMBY movement, which means yes in my backyard, on messages that can transcend politics and change mindset. The big message from YIMBY is that keep the focus on housing. Don't attach every other possible agenda to it, and you can persevere. Next slide. So here's our Greenwall project, which, as my colleague said, arrived at a wonderful moment. It was one of the most exciting grants I've ever gotten, and I wish it could be renewable forever. Collaboration between the Harvard Joint Center for Housing Studies, the Hastings Center, also health policy expert Lauren Taylor and Greenwall faculty scholar, and our research network. Our initial plan, being good scholars, was to produce issue briefs for state and local policymakers. This was modified through input. You talk to enough people and they say things like, the issue brief is dead. People use slide decks in place of issue briefs. And so, the issue brief is not completely dead, but we took their point in terms of who we were trying to reach and what would be helpful to them. We couldn't stay too close to academic categories. We do have some of our material in a paper covering technical topics that gets into problems of knowledge commons issues like data sharing. But in terms of the discussion tool to really help local policymakers, we kept it in the slide deck mostly. Development via a number of national and regional audiences, and piloting in March at the American Society on Aging, which gives a wonderful forum for policy roundtables to try out tools. Next slide. So one of the things we talked about was to get beyond the term aging in place, to understand how to help people drill down locally into needs where they were. Our sense of policymaking audiences was greatly refined to include elected, appointed, or administrative officials. Mayors are important. Zoning board members are important. A lot of these are involved citizens, many of whom are retired and have a long-term interest in their communities. Next slide. This is basically the agenda, the flow of the discussion tool. Next slide. This is a sample discussion prompt side, helping people in a group, let's say in a town, in a county, trying to make progress on this issue that they know is needed. And it's a way of talking about NIMBY. What are some of the reasons given for saying multi-unit housing is unacceptable, or rental housing, or we shouldn't spend money on older people, or we need that nice view, we can't block it? And so what has worked? You're getting from the challenges to the opportunities to the success stories, and then you're saying, and what else? Next slide. So these were just all of the people who were involved in this. And I want to especially thank my colleagues at Harvard, at NYU Langone, at Leading Age New York, and at the Center for Healthy Aging in New York City, who greatly assisted with the piloting. I'll be happy to discuss any details via email or during the discussion. Thank you.
Wonderful. Thank you, Nancy. And thank you again, all. So now let's shift to a group discussion about overarching takeaways and lessons learned about translating bioethics to policy. So looks like you are all doing it, but please, if all of the panelists could turn your cameras back on. And as that happens, as a reminder to the audience, please submit any questions you might have using the Q&A button. So as we as we wait for Bob on camera, let me pose a first question. So one thing that came through to me as I listened to you all speak, and even as I saw the closing slides of all of your presentations, was really, I guess, what I'd call maybe a thread of humility, a recognition that bioethics researchers themselves don't necessarily have all of the skills needed to translate research to policymaking. So I'm curious if that observation resonates, and if so, I'd love to hear a little bit more from all of you about the gaps you recognize in your team's skill set and how you went about filling them.
I'll start if you like.
Please, go ahead, Nancy.
Sure. I think some of the things approaching with humility is first, really being willing to learn from whoever you pilot something with, to be prepared for them to say, you know, I know you want to do it that way, but that isn't it. I remember one member of our research network is a not-for-profit housing developer, and she wrote me these, after some of our discussions, wrote me these very long emails saying, I'm retiring the phrase aging in place. Now, there's a lot of attention to the phrase aging in place. A lot of people use it in the vernacular, in the literature. She said, we need to help people age in community. Here's how I do it. And so while I took that, I know that a lot of people use this term, and some people have made whole careers and whole lines of research on this term, but I kept things open and I did not insist on this phrasing or that phrasing. The other, and I think this came across in many of our presentations, especially Kirstin's, was the attention to the political moment. You have only so much time to do things. Kirstin talked about that. Kirstin talked about that. In New York, our governor announced a housing compact that ran right into suburban NIMBY. So we thought, oh, that's going to be a great hook. Oh, that's dead, you know, for another year. Maybe it'll be resurrected. So there's that too, just being very attuned to what's going on and not being too locked in to your own plans.
Thank you.
And I'll chime in and say, in terms of humility, all you have to do is one of these rehearsal sessions and realize how incredibly enmeshed we are in our details and abstruse academic prose and stuff like that. So, I mean, it's easy to be humble, and the expertise that the Burness folks brought, really, the training programs really changed a lot of how our students and I were trying to convey our message. It took 3 or 4 iterations. So it's not even a question of humility, it's a question of effectiveness and drawing on skills that we don't really learn as academics.
I think what I would add is that it was a little challenging because we had a lot of people whose beliefs were completely different than my own that we were walking into. We were walking into a representative who was proposing ways of limiting access to vaccines. And I didn't agree with what he was doing, but you're in that position where you have to keep the relationship long-term and not think about the short-term arguing with them. You could try, we tried pushing the staff a little bit about the thinking, but you know, you hit a particular barrier. Instead, we just kept having students come into their office and talking with their staff on a regular basis, just so they know that the ones they're listening to that are wanting to restrict vaccines are not the majority, is to making sure. But yeah, there's a bit of humility when you walk in and realize that nothing I do will probably actually make a dent in this individual's perspective.
So let me actually build off that sentiment a bit and really place us in time, I suppose. So as we sit here in June 2024, I'm curious if what you might say, how you might reflect on doing policy related work in such a polarized landscape. I mean, what do you, what have you, what shouldn't you do to reach beyond friendly ears?
Well, I'll start first. I am picking a particular topic that's extremely controversial at the moment, unfortunately, vaccines. We did it intentionally. We actually moved into the space when it became polarized within the state of Texas, and then saw it kind of migrate into the conversations across the US. And it is something that you have to keep aware of, that the relationship building are kind of long term. And then you also have to kind of keep trying to determine, that's where the communication piece is really important. You have to play defensive, but also you have to figure out how can we keep changing the message so that our message is heard differently. If talking about people dying from vaccines isn't effective, then you should try to figure out, well, what is a better effective message? Well, keeping your child healthy apparently is more effective than talking about the small risk of your child dying. And so then we have to figure out how to pivot. Talking to a Christian conservative in Texas, that yeah, you should have individual rights, but as a, you have a plaque there telling me that you're a Christian legislator. As a true Christian, you should actually be thinking of others a lot more than what your personal benefits are. So just trying to reframe things is kind of how you have to, and I think the communication piece that we all approached others for was really important.
So one thing that I'll say about, so Congress is incredibly divided now, and issues that the power has been sucked up to the leadership over the last 2 decades. The power, the staffing, and all that has been sucked up to the top, which means that political frameworks infuse every issue, including the ones that really used to be pretty bipartisan, like patent is pretty bipartisan. Research policy used to be fairly bipartisan. But one thing that we learned is to be, somebody said basically, it's easy to talk to your friends, but it's most important to talk to the folks who may not agree with you. So we've been pretty systematic about doing that. And one way of doing that is actually to talk to, in our case, we're talking to people on the Hill and asking them, who should we talk to? And where are the points? We don't care so much about folks who are already, in agreement with the points. We're really interested in the people who need to be persuaded. And we've asked that specifically at the end of our briefings, who else should we talk to and who's going to be opposed to this and how do we do that? So you use basically a snowball sampling method to identify who further you should talk to.
I think on this issue, the interesting thing about housing is everybody has to live somewhere. And so there's a relatable aspect of it. And I think that's when you see the YIMBY movement, you see, as long as we keep it on that really helps. You can try to keep it off third rails. And also some of the success stories come from red states because they tend to have less lighter zoning, shall we say. There's a lot of success stories in Houston. They build a lot. My city, New York City, not so much, it's a lot harder. And so that helps because you got all these, you can have stories from different places that it doesn't say that one group blocks it and one group is better at it. But really, I think having a network of your own where you're trying things out all the time. Like I think I've come up with some good phrasing. I was run it by somebody who works in Greater Memphis, Tennessee, because she said, my legislature is not generous. They're not friendly. If I can't talk about savings and no tax dollar will be used in this, they won't listen. So that's a good reminder for me that anybody who's actually going to move forward with this, I'm not going to be the lobbyist or the advocate. They're going to have to get to yes locally or regionally, is going to need a number of different ways at the problem. But I can avoid gumming up the works by coming up with, oh, here's the way you have to talk about it. I'm learning all the time.
Great, thank you all. I really appreciate that. I am holding back the impulse to just keep asking questions that have come to mind for me over the last 40 minutes or so, because I just find this all so fascinating and your work so relevant to the foundation and what we've been thinking about. But let me turn to some of our audience questions. And again, a reminder for our audience, please feel free to add questions into the Q&A box. So first one I've got here, how did you know that you were ready to take your research to public policy and this type of work? What was the threshold for you?
I can start first because I think mine was the easiest because we were seeing bills going in the 2021 session and lots of conversations and the ones before that that were restricting access, that were ignoring public health issues. So it really also worked really well with the students because it explained to a bunch of pre-meds or medical students that vaccines are an important part of public health. It was a really easy sell. So mine was a little bit easier. I do some other projects in research, and it's just, I actually recommend when you get towards the point where you feel like you need to make a large change, then you should just start tiptoeing into the space.
I think in our case was because we had come off that pandemic pivot project funded by the Retirement Research Foundation, which was looking for research that could be helpful to community level practice and services. And because we had this group of a network that included policymakers, we had a really clear sense that they said, okay, now things are about to go, back to normal. Let's take advantage of this window. You've got this housing lens, start using it. So that was the chance to really get clear on, and we knew by this point that most of the action is local or municipal. You kind of don't have to worry about the federal government unless it's HUD funded public housing. And we knew that the biggest, if you were building something, was likely to be that moderate income group. So again, it's just the timing. You just sort of know that it's ripe enough, but it's not you deciding. It's usually somebody who's very well situated who said, go now. On it.
So, and in our case, Michelle, there were, number one, the whole Solston project was all about doing policy-oriented research, and we'd gone through a systematic Delphi process. And for those in the audience who are interested, just read all the stuff that Amy McGuire's group and Mary Magender and Christy Guarini and Jill Robinson have done. And it basically helps you winnow down what are the policy levers and what can somebody do about this problem. In the case of the payment stuff, that was a problem that everybody agreed on, and there are only two places that can fix that, the executive branch and Congress. So that made it pretty obvious. That one was ready, and that's been prepared for decades. The situation for the patent was they actually introduced a bill, S-2140, that Tillis and Coons, Republican and Democrat, have introduced to actually reverse the Supreme Court decisions. So that happened last June, a year ago. And so that's a real opportunity, and it's a real focus of congressional debate. So we didn't make that decision, the world did.
Thank you all. So another question from our audience: what advice would you give to new researchers who are interested in bridging the gap between bioethics and policymaking?
So I'll start. The single thing that I think was most gratifying about this was giving our students and junior faculty an experience of doing research that actually matters and learning the set of skills, beginning to learn the set of skills that allow you to do that. So I would say I loved what Kirstin was talking about, especially the dinosaurs. I mean, that was just amazing. And I just see if you can structure your work so that it's not just you, it's just not the academics, it's also a much broader community that gets that experience.
If I could just add to what Bob said, I feel like if you find other people who are into the space, maybe they're a little bit more senior, everyone who does policy wants more people to help. Wants more people to go in. So I threw my contact information in there, which I do on all my talks. If you're interested, and if you look at what we do at the Baker Institute and see something that links in well with some of the stuff you're doing, is, feel free to contact and ask about engaging in projects we do. Obviously we all sought out help from other people, and I think we're all amenable to, if you have something, or we might know somebody else who might be more appropriate maybe for your particular project. But yeah, feel free to reach out.
I would add to that, don't be afraid of cold calling people. If you read a really good report that's put together well, and you're seeing it cited everywhere in the public sector, or the person is giving congressional testimony or whatever, call them up. That's how I made my research partnership with Jen Malinsky, because I just read her report on housing and aging society. And she said, I've been waiting for somebody to notice the fact that every 2 years I report on growing inequality in our housing market, but all I can do is report on how much worse it's getting. And I'm like, well, I thought, and so that's what happened. And so, and then you find out that there are these other postdocs who are coming up, who have more policy-oriented analytic skills and are being trained in different kinds of writing, who will partner with you. So you don't have to invent it all yourself, but you have to be willing to collaborate with people who just come with those skills. I would say hang out with people like that. Find a network at your university. Go to their webinars, go to their lunchtime talks, and see how they do it.
Thank you. So there's a number of questions coming in on metrics of impact and of success. So let me kind of dive into one of them, maybe combine it with a few. But what are metrics of success for your projects or other projects like this? Is it passing a bill, completing a project? Is it raising awareness? And really, what does it mean to have impact or success in an imperfect policy world?
So again, I'll start. This is a hardy perennial. It's a really, really tough nut to crack, and more credit to Greenwall if you can figure out how to contribute to this. But I will say, I worked at the Office of Technology Assessment. We had a whole session on how do we measure whether we're making a difference. You can count legislation that's passed. You can count legislation that's blocked. You can count saving of money based on the policy choices that are implemented. And you can count publications. And the only one of those that's really easy to count is publications. And actually the other one is whether a bill passes or not. But those are actually not the ones that mattered. Just to give an example, the first report I did at OTA was on Alzheimer's disease. And the stuff out of that report that mattered was driven by the 2 social workers that were involved in taking care of patients, as opposed to the research recommendations that we made that really didn't change the world very much at all. But the legislation was all on that research front, and the implementation was actually because the Robert Wood Johnson Foundation picked up on it, did something with it, and created a whole set of services using a financial model of inducing community organizations and funding them long enough to get launched. So it wasn't our recommendations on research that mattered. It was actually doing something in the real world that relied on something that I don't know how you measure that. I guess you could say the Robert Wood Johnson initiative came out of or was linked to our project, but we were only one part of a really, really big apparatus that was involved in that movement. So I don't want to claim credit for it.
I agree with that. I think a lot of policy is consensus building. So you can, as like an individual, can't say I did this very often. You say that there was hundreds of people. I mean, I brought in the students and because there was power in numbers. You obviously look at bills passed and filed that you have, but also for our case, sometimes we're really excited with bills that don't pass. We're like, oh gosh, we did not ban school mandates for vaccines or requirements for vaccines in Texas, which we were really proud of. In addition, it's those meetings you're able to get and actually start conversations. I know that in our particular space, there's lots of people who are completely against vaccines, who voted against a resolution. Those aren't the ones we were trying to engage with. We were trying to engage with the people in the middle, right? That we're floating between, like there's an extreme ends, ones that support us, ones that don't, and then there's the middle that you're undefined, and getting meetings with those, with the staff, but more importantly, getting the members to talk to us, I think was really important.
Being married to an architect, I absolutely know that I will never be able to claim credit for building anything. And I know how long the time frame takes and all of the ways it can be stalled. But I will say a metric of success can be when you lead a national discussion group in person and a developer says, we need more of what just happened here. He said, you know, we're also tuned to webinars that get us continuing education where the discussion is restricted to chat, and we get our certificate, but it's not the real deal. What worked, and that he said, you see how much people need it. So I think part of the metric is, are you invited to talk about this in gatherings that matter? If Kirstin got invited to talk about this in a state with a similar political profile to the dynamics, I think she would count that as a metric of success, you know? So that's important too. So, but it does mean keeping up a flow of work and showing that you've got fresh things going on and that your topic is important.
Thank you. So another question from our audience. What do you see as the role of the general public to support this kind of translation effort? And how can bioethics scholars engage the public more effectively in this type of work?
I think it depends on which public we're talking about. It doesn't have to be everybody, but you do want to know who your publics for your issue are. For example, in the case of the problem I was thinking about, or the challenge, is I'm kind of hopeful about housing in a way, is that when you understand that the policymaker may be the mayor of a town who is also involved with the local university or is an appointed official on a zoning board, and they also are involved with the library, you realize where policy starts, you know? And when that person says, you know what I found really helpful for NIMBY in my single hall colonial town where they're afraid of change, is to use the reframing aging toolkit that the Hartford Foundation helped to develop. I'm like, that is a smart idea. They found it by themselves. They were just looking for a fresh way to talk about aging. So picking up on what people are trying, and I think one thing is really important, it has to be accessible. It has to be no paywall, does not require knowledge of PubMed or Google Scholar. It really has to be super accessible. And this goes to a question that I saw in the queue about, it's not really, the issue brief isn't really dead, but think about the suite of things. Can you give the same information in an issue brief, a really simple summary, a data pack, and a ready to go slide set, and do a webinar to launch it all? Then people know about it and they can use the tool they need.
Bob or Kirstin?
She's right.
Perfect.
We got students to come in, and I think that was one of our publics, and we want to continue those process, and we're trying to work with some of the universities nearby so that we can continue that idea of going in and engaging on a regular basis, but also expanding beyond just students and also getting more parents involved, because I feel like most of this is talking about school age requirements. So let's try to find more people and then try to expand who actually engages in our particular topic is what we're focused on. Yeah.
So the one thing I would also add is the media are usually the way to get the attention of policymakers. So a communication strategy that says, here's the message, that this is what needs to get fixed and here's why, going out to the media is a really effective leverage point for reaching policymakers.
Thank you. Now,
And I would just add to that we have investigative journalists in this country who have PhDs, who are very, very well trained. And also we have people on the health beat who have to cover lots and lots of topics, but they got up to speed during the pandemic. So knowing who are the people who love or who get up and breathe your issue every day in your sphere is really important. There's some great people on the housing and health beat right now nationally, as well as in more specialized but open access publications. So knowing who they are and just making sure they're on your media list is important.
great. Thank you all. So we are coming really close to the end of the hour, so I'm trying to decide if I can squeeze one more in, and I am going to, because I'm curious your answers, but I'll ask you to keep it short, which is taking a step back. We've been talking about these one-off projects y'all have done to bring bioethics to the policy table. What can you draw from this about getting bioethics a more sustained seat at that policy table? What if kind of having more long-lasting, cross-cutting issue effects? Any thoughts on that?
Well, I advocate that we need a presidential commission on bioethics again. We used to have it, and I wrote a brief when President Biden got into office that it should come back again, and I'm disappointed that we haven't. So that's one of the places that, especially at the federal level, I think would also help keep the conversations going. And we have a long history, even back to Reagan, of having one of those. It's just the past two administrations haven't.
And I guess the only thing I would say, Michelle, is to repeat a point I made before, which is if you can give people early in their careers an experience of doing this, they're going to get addicted. It's really, really fun to see something that you've done turn into something that happens in the real world. And that's an incredibly healthy and fun thing to do. And if you can structure your work so that that happens, I think it kind of takes care of that issue.
And I would add, if you're at a research university, consider how your university can be an asset to local efforts. There's great work being done in so many domains. Emily Greenfield's work at Rutgers on building a hub for innovation and aging in that state is one example among many. That's usually the secret sauce of how academics can support the community. There's some collaboration there.
All right, well, thank you all. And we are pretty much at the hour. So that will be it for the webinar today. On behalf of the Greenwall Foundation, I'd like to thank all of our panelists for their thoughtful presentations and robust discussion. And thank you to our audience for your participation. The recording of today's session will be available on our website and YouTube soon. And just have a wonderful day, everyone. Thanks for joining us.